and how many doses of that have been given?
I don't have the precise number of doses that have been given. That is something we could ask our team to research and provide to you, Denise. And I turn to Dr. Westergaard to talk about the effectiveness of this treatment, its impact on hospitalization.
Sure. I don't think, similar to what Julie said, we don't have population-level data that really estimates the impact, how much did this cause. But what we know about the efficacy of the treatments themselves, they did, when they were given to people, particularly people with high risk for hospitalization, there was a modest decrease in the risk of hospitalization. So they received emergency use authorization based on those data. So they are one of our many tools to try to prevent severe disease and deaths. The rollout, I think it's definitely a minority of infected individuals who receive these doses, but I'd be happy to help follow up with the precise number in Wisconsin of doses if we can get that.
Thank you, Denise. Now to Dan Malloy from Spectrum News. Dan. Dan Malloy from Spectrum. Okay, moving on then to Madeline Anderson from WITI TV in Milwaukee. Madeline?
Hi, I saw that the alternate care facility hasn't had any patients in quite some time, and I was just wondering what the state's plan is in terms of, are you going to keep it open? Are you going to close it? And could it maybe be turned into a max vaccination site potentially down the road? Thank you.
Thank you. We continue to monitor our hospitalization rates, the rate of disease, and evaluate whether we should continue to keep the alternate care facility available or not. Certainly one of the factors that we are considering is what patterns we may see with the new variants that are emerging across the world and are certainly present here in the United States. So it's that great balancing act about you don't want to close it too early in case we would see additional surges in disease related to the variants or other causes, but you also can't keep it open forever. So we are actively in evaluation of those items and considering other uses for State Fair Park as we move forward.
Thank you, Madeline. Now to Mary Spacuzza from USA Today Network, Wisconsin. Mary?
Thanks for doing this call. Can you explain how the process works for allocating, transferring, deferring, canceling doses to or from the pharmacy partnership program? We were getting a little confused about the different terminology that was used, and we wanted to get a sense of how many doses are currently in that pharmacy partnership program now, because I know some have been canceled or deferred.
Sure, I can try. This will get a little technical, but so when the program was started, there were two parts. Part A is skilled nursing, Part B is for assisted living. CDC determined how many doses we needed to allocate to each part of the program. 56,800 for the skilled nursing, 140,000 for the assisted living. All 56,800 doses have been transferred to CVS and Walgreens for the skilled nursing program. And I'll have to get you the exact number that have actually been transferred to the assisted living program. We are doing a number of shifts right now, and so I don't have that number right at the top of my head. The reason we are doing some shifts right now is because CVS and Walgreens have completed the skilled nursing facilities, so they know exactly how many doses they needed for that program. And it is fewer than the 56,800. And they are now, as they begin the assisted living program, doing that same kind of evaluation. And so we're looking at that. We don't want to short doses to CVS and Walgreens. They don't have enough doses to administer to our vulnerable elderly residents of those facilities. But we also don't want to give them too much vaccine, because once they have it, they will use it, but they will use it through their retail pharmacies for Wisconsinites. And if they're not going to use, for example, 30,000 doses, we might want to bring it back and use it in other avenues for Wisconsin residents. In addition, I can tell you, we canceled 12,000, I believe it was 12,700 doses. We can confirm that number. We canceled on the assisted living program 12,700 doses with CVS, because they told us clearly we're going to be under, and that was the weekly allocation to CVS for those doses. And those doses are being redirected to independent pharmacies and, in some cases, local health departments who are vaccinated assisted living facilities. Because as we've discussed before, some of the assisted living facilities, there are so many that CVS and Walgreens have asked for assistance from other vaccinators. So those vaccines were canceled from the pharmacy program, put back into the vaccine stream for our Wisconsin vaccinators who are addressing those populations.
Thank you, Mary. Now to Emily Davies from WSAW-TV in Wausau. Emily.
Thank you for taking my call. My question is also related to the assisted living pharmacy program. I talked with an assisted living facility earlier this week, and I guess if you can explain a little bit further about when they'll be able to get vaccinations to people. An assisted living facility in our area that I talked with mentioned that they don't even know who's going to be vaccinating them. They've actually asked the residents to start signing up that are eligible in the 65 plus to start signing up with their own healthcare providers, because it might be faster. I guess, can you talk a little bit more about when and if that's advised?
Yeah, the plan for those who will be vaccinated by CVS and Walgreens is that they will be vaccinated, receive their first dose of vaccination. Let's remember, this is a 2-dose series. So their first dose in February. Again, as we've said all along, we have a lot of facilities in this group, and a lot more than a lot of other states. And CVS and Walgreens are finding that out as they go to schedule people. I know they are also looking at bringing in staff from other states to assist with that. If there are assisted living facilities who are uncertain, we encourage them to contact us. We can help them determine who is vaccinating them and help clarify communications if that is becoming an issue. But they are reaching out to those facilities. The program officially began this week. They had already started reaching out last week, and they are moving forward with scheduling and coordination of that, and the plan is to reach all of them in the month of February.
Thank you, Emily. Now to Mason Dowling from WAOW-TV in Wausau. Mason?
Hi, this is Natalie Sapila in for Mason right now. Thanks for taking my question. I wanted to ask, we've noticed on the DHS vaccination page that women more than double men in vaccinations in Wisconsin. I'm wondering if you guys have any insight into why that is. Thank you.
Yep, absolutely we do. If you look at the healthcare workforce, I think you will see a very similar gender distribution. And remember, our early stages of vaccination have been largely focused on the healthcare workforce, which is the biggest proportion of current people vaccinated. You know, certainly our hope is as we diversify who is receiving vaccine, you'll see more evening out of the demographics, and we strongly encourage all genders to seek vaccine for their protection.
Thank you, Natalie. Now to Jessica Van Egren from Up North News. Jessica.
Yes, my question is for Dr. Westergaard. With the different variants of the COVID-19 virus coming over, we've started to hear some suggestions as far as double masking is concerned. Do you have any thoughts on whether that is something that people in Wisconsin should start to do? I guess that's just my question on double masking, if it really works, if it's worth doing it. Thank you.
Sure. Yeah, it's a good question. There's been a lot of discussion about this locally and nationally. There's not great scientific evidence that one mask is better than two. It's never been studied that way. But we do know a fair amount, particularly when it comes to homemade masks, that not all mask designs are created equal. And what I mean by that is when we've done studies to see how well different types of fabric block respiratory particles from being spread into the environment, they really need to have multiple layers. So a single layer of cotton, like a bandana or a fleece neck gaiter, there have been some studies that show that the particles pass right through those. So one simple rule is that if someone is wearing a mask that's not a medical grade mask, it needs to have multiple layers, and wearing two masks might be one way to make sure that there are multiple layers. The other key to the success of masks is that they fit well around your face so that the air goes through the mask and not around. So some people have found that wearing two masks might result in having a closer fit to the face, and that's also another reasonable way to do that. So I think those are the important principles. I don't think we're recommending that everyone wear two masks as a rule, but people should be aware of why and how masks work. And if using a strategy of two masks for a better fit or better filtration is an option, then I think it's reasonable to do that.
Thank you, Jessica. Now to Erin Sullivan from NBC 15 in Madison. Erin. Erin Sullivan? Okay, we'll move on then to Emily Fannin from CBS 58 in Milwaukee. Emily?
Hi there. Thanks for doing the call and appreciate you guys fixing the audio issues. Governor, this question is for you. I know you've said a few times on this call that the mask order, of course, hasn't passed the resolution in the Assembly, but Speaker Voss said they will eventually vote to revoke your mask order. So will you issue a new emergency order requiring Wisconsinites to mask up, if not a matter of when the current one in place is struck down by the legislature?
Well, certainly it's, Emily, that I've been a mask advocate from the beginning. It's an easy thing to do because it saves lives. So I will continue to make that promise that the people of Wisconsin will do everything in our power to make sure they're safe. And as we consider what role we will play going forward. But I'm still, until it happens, I mean, you've seen the last couple of days of bouncing around from each house to each house, and I think it's premature at this time. I know what the speaker said, but until it's done, it's not done, and we still have a mask mandate in the state of Wisconsin.
Thank you, Emily. Now to Taylor Lumpkin from TMJ4 in Milwaukee. Taylor.
Hi, good morning. How are you guys? Just a quick question. I wanted to piggyback off of a couple other questions, really, but just going back to the Milwaukee Bucks VP who was vaccinated. I understand that you don't want to see any of the vaccinations go to waste, and I know it's kind of goes up in the air, but, you know, would you like to see a better system in place in terms of when the vaccine goes to, you know, someone who is really in need, when it comes to someone who might be at risk, or is it really just up to the different healthcare systems, healthcare providers, as in terms of how they want to go about giving those leftover doses to either those in the 65 and up group or to anyone who just might be available for it?
And I'll just try again. First of all, I obviously don't know the circumstances of the specific issue, but there may be times out of the 460,000 or the great number of vaccinations that we've had, there may be times where when we're telling people to get a shot into somebody's arm, out of those 460,000 plus people, that some of them may be kind of out of sequence. I would rather have that. And it's going to be a small n. It's going to be a percentage of a percentage of a percentage. And I'd rather have them do that than throw something away.
And if I can just add, every one of our vaccinators signs an agreement with us that says they will abide by the prioritization that has been established by the Advisory Committee on Immunization Practice and our state Disaster Medical Advisory Committee and DHS. So they know who they are supposed to vaccinate. And if they perpetually violate those recommendations, we talk with them. And if they would continue to do that, we have the option of not giving them more vaccine. We have talked to a number of places where we know there were misunderstandings about how they were moving forward and have seen changes in behavior on that. And we have also, as I said, mentioned that we control the vaccine supply. And so if there are perpetual violators of that, that is an option. But we have also said to them, as the governor says, get the vaccine in arms, and there is no way we can police every single vaccine that is put in an arm at the end of the day.
Thank you, Taylor. Let's go back to David Wahlberg from the Wisconsin State Journal and see if he's available now. David Wahlberg?
Hi, can you hear me this time?
Yes, we can. Thank you, David.
Great, thank you. I just wanted to confirm, I think you said 45,000 doses yesterday. That seems like it would be about 125,000 so far this week then, and that doesn't include today. I'm a little confused how you can give something like 130 or 40,000 doses in a week when you're only getting 70,000 from the government. Is that just because of the booster shots or what? And then also, can you say how many doses have been given in nursing homes and in assisted living so far?
So, David, I want to be very clear. We say 70,000 first doses a week we receive from the federal government, because we're measuring it based on how many new people can come into the system. So, and that is how they give us our allocation, is in first doses, and then they also add the booster doses onto that. So the fact that your math is showing we're at about 125,000 reflects what we are seeing, which is, I mean, yesterday it was about 35,000 people received first doses, and about 8,000 or 9,000, I don't have the numbers right in front of me, received second doses. So it is a combination of both. We can get you the skilled nursing and the assisted living numbers, but we'll need to follow up on that. I don't have those data right in front of me.
Thank you, David. Now to WKOW TV in Madison. WKOW.
Hi, good morning. This is Nick. So does Wisconsin have any purchasing power to buy its own vaccines instead of going through the federal government if the concern right now is how much we are getting from them?
Well, I'll just mention something just on a broader scale. We experienced the Wild West one other time in this pandemic with protective equipment, and it doesn't work. The idea that somehow we're going to compete against other states and actually be able to do it when we're a relatively small state, about 2% of the U.S. population at best. So the opportunity for us is not good. This should be done at the federal level. We don't need the Wild West. It'll turn into a mess, and we won't be able to recover from it. So I'm against doing that, and especially as a small state. Yes, we could combine ourselves with other states. We tried to do that with PPE. That didn't work well either. So that's the 30,000-foot view of it.
Plus, I don't think there's a whole lot to buy.
Thank you, Nick. And our final question this morning belongs to WISC TV News 3 Now in Madison. WISC.
Hi, thanks for taking my call. Back to the Johnson & Johnson vaccine rollout, is the state developing a plan for how to handle conflicts with that? And what I mean is, I was reading Washington Post this morning. Some experts suggest that there could be an issue with people wanting to choose what vaccine they get based on efficacy. So I guess my question is, how is Wisconsin planning to deal with that particular vaccine? Thank you.
Yeah, already we have two different vaccines that people may want to choose which vaccine they they elect. And that's just not possible in this situation of scarce resources. So we will get vaccines in the hands of our vaccinators, and they will vaccinate their patients. Patients always have a choice to say no if they don't want the vaccine that is available to them and wait until they might be able to find the vaccine that is. But our goal is to get all vaccine out in the hands of vaccinators as quickly as possible so that they can get it in the arms of patients as quickly as possible.
And that concludes today's briefing. Again, we want to thank you for your patience as we worked on our technical difficulties. If you need more information on COVID-19, please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a good day.